There's a growing divide over how to care for transgender youth.
A landmark report into gender services for children and young people says they have been let down.
Access to drugs known as puberty blockers, now limited in several European countries.
Sweden is overhauling its policies when it comes to transgender teenagers.
Puberty blockers also facing political opposition in Canada and the US.
Puberty blockers for minors?
Do you agree with that?
Do you agree with that?
I think that we should protect children.
Many experts say the drugs are life-saving, a crucial treatment for youth in distress.
For my daughter to experience male puberty would be devastating.
I've had patients who refuse to eat or sleep until they're able to move ahead with interventions.
But with a rise in youth presenting at gender clinics and the risk of potential side effects, what are the challenges to prescribing responsibly?
The last thing that I want to do as a provider is cause harm.
And where does this debate leave young people and their families as ideological battles swirl around them?
Yes, let's just get mad and shout trans rights are human rights!
We're in Alberta, the province planning to ban puberty blockers and hormones for anyone under 16 who isn't already receiving them.
Enabling children to alter their very biology poses a risk to that child's future that I, as Premier, am not comfortable with permitting in our province.
Things are really tense here in Alberta. The government says its plan is about protecting kids, but trans youth we've spoken to, their parents, their doctors, they say it would have the exact opposite effect.
At this gathering for trans youth and their families in Edmonton, we meet Patricia Zentilli and her trans daughter. Zentilli says puberty blockers have given the 13-year-old a chance to live.
I think there was definitely a sense of relief, like, okay, I don't have to worry that my body's gonna start doing these things that are gonna feel even worse. Because for my daughter to experience male puberty would be devastating, and her mental health would definitely be just at risk. I don't think a government belongs in private medical decisions, like about our a private with this minority of vulnerable people.
The Canadian Medical Association echoed that criticism, writing it's deeply concerned about Premier Danielle Smith's plan, adding Canadians have a right to make personal choices about their health free from political interference. But polling suggests 42% of Canadians agree with Smith's planned age restriction.
For someone out there who thinks that, yes, restricting the use of puberty blockers is a good step, what would you say?
Before I had a trans kid, I might hear a policy like this and go, oh, well, that makes sense. They shouldn't be doing anything like that until they're older. But when you actually have a trans child, you realize, wait, no, they know who they are.
Okay, I'm just going to show you this medication and what that looks like.
To learn more about puberty blockers, specifically a drug called Lupron, we meet Dr. Simone Leboeuf, an adolescent medicine pediatrician in Edmonton.
So it's a medication that pauses a signal from the brain to the gonads to stop releasing sex hormones, so either estrogen or testosterone. And then the body no longer would go through development of those secondary sex characteristics like chest development or voice deepening.
And after that?
After that, then they would either have to make a decision to come off of Lupron and continue with the puberty of the sex they're assigned at birth, or to consider starting affirming hormones, so estrogen or testosterone.
Those hormones can lead to permanent changes, the start of a medical transition.
And so for puberty blockers, that pause is to give someone that space and time to figure out next steps.
Leboeuf says the government's plan to ban puberty blockers for anyone under 16 will make the treatment ineffective for youth in need.
On average, for someone assigned female at birth, they would start puberty between age 10 to 12. For someone assigned male at birth, they'd start puberty between 12 and 14.
So the care would come too late.
The care would come far too late.
Nationwide data shows a rise in youth being referred for puberty blockers and hormones over the past 2 decades, though some major clinics now report referral numbers have started to decrease. The vast majority of these young people were assigned female at birth. Referring to puberty blockers, the Canadian Pediatric Society says hormonal suppression has been associated with lower odds of suicidal ideation.
I've had patients who refuse to eat or sleep until they're able to move ahead with interventions. I've had patients who've locked themselves in bathrooms, who've tried to cut body parts off. And so often you see things like when patients have an appointment for the first time, I'll watch in their chart, like all the emerge visits stop, all the crisis visits stop.
But in Europe, puberty blockers are coming under increasing scrutiny.
Sweden is overhauling its policies when it comes to transgender teenagers.
Citing in part concerns over the rapid rise in youth seeking out the care, several countries in Western Europe are now adopting a more cautious approach on puberty blockers and hormones. In Sweden, the first country to legalize gender transition, national health officials say puberty blockers should only be given in exceptional circumstances. And in France, the National Academy of Medicine recommends maximum caution when prescribing puberty blockers. The strongest new measures are in the UK, where puberty blockers are now banned outside of clinical trials.
A landmark report into gender services for children and young people says they have been let down.
Earlier this year, the nearly 400-page CAS review was published, a wide-ranging and controversial examination of gender identity services for youth in England. It found remarkably weak evidence for medical interventions in youth gender care and concluded that for the majority of young people, a medical pathway may not be the best to manage gender-related distress.
Ideology on all sides has directed care rather than care being directed by normal principles.
Changes in Europe have had little impact on medical authorities in other Western countries like Canada, the US, and Australia, all continuing to back the treatment.
I would say if you look at the...
Dr. Daniel Metzger co-wrote the Canadian Pediatric Society's statement on gender-affirming care.
The bottom line is that there's no medical treatment that's 100% safe. Most clinics in Canada have been cautious, and as we evolved this over the past 26 years in Canada, we found that it seems to be that what we're doing is the right thing for many kids.
But doctors here don't deny there are possible side effects. For puberty blockers, they can include risks to bone density. For hormones like estrogen and testosterone given later, the Canadian Pediatric Society says they can permanently decrease fertility to an extent that is not yet fully known.
Are you confident that people at that age can understand those implications?
I do have young people who are capable of making those decisions. Parents can also take on that gap in decision making. So when we're looking at these possible risks, we're also weighing them against the risks of doing nothing.
LeBoeuf says no one at her clinic goes on the meds without a thorough assessment.
So I would do an intake appointment with the family, looking at their mental health, their social supports, their past medical history, their gender story. I'd screen for other mental health concerns, so things like neurodevelopmental problems. And so it's a pretty comprehensive look at someone.
But the assessment process can vary depending on who prescribes the medication. While it takes months, if not years, to get into a gender clinic, puberty blockers can also be available through family doctors and some advocacy health organizations.
I think there's a wide variety of approaches here in Canada. Some providers that I know are not supportive, and kind of like the extremes where a youth may come in asking for, hormonal therapy, and that's, quickly given.
Toronto pediatrician Dr. Joey Bonifacio prescribes puberty blockers. He's also one of few Canadian doctors publicly saying shifts in Europe should prompt a rethink here.
I think for very thoughtful medical doctors providing this care, the CAS report wasn't anything new because we were noticing these trends and talking about them. And so then how do we approach this in terms of, a developing, maturing, and changing brain, making permanent decisions?
Bonifacio is against bans on medication, but he says with more young people seeking the treatment, more caution is needed.
There are so many things that are going in an adolescent young adult's life, and the last thing that I want to do as a provider is cause harm.
Are you ever worried that you'll make the wrong decision as a doctor in this area? You'll determine that someone doesn't need the medical pathway, but they might? Do you ever worry about that?
Oh, all the time. I'm also taking into account like the increasing number of persons, even my own patients, who've changed their mind and who stopped their treatment.
Bonifacio referring to a process known as detransitioning, when someone chooses to stop their transition.
You know, I look back and I wonder, is there anything that I could have done differently or approach it differently to try to avoid those outcomes?
Stories of detransition have been used in arguments by those seeking to ban gender-affirming care altogether.
Stop the chemical, physical, and emotional mutilation of our youth.
And that can make some who support the care hesitant to talk about those who do change their minds.
Some of the results and reasons for people detransitioning do sometimes threaten some sort of trans orthodoxies.
I started my transition in 2009, and some of my own friends have detransitioned.
Kinnan McKinnon, a trans professor at Toronto's York University, is one of few researchers studying detransition, using social media to help destigmatize it.
Deeper understanding can help to improve care.
Kinnan says he's personally interviewed about 100 people who've detransitioned.
The number that we've been repeatedly told is less than 1% when it comes to detransition.
This has been underestimated in the past. That said, I do want to be really clear that I don't think this is the majority of people, but I don't think it's 1%.
Do you anticipate that you'll see a rise in people who perhaps were medically treated one way when they were younger and maybe shouldn't have been?
Let's say that the detransition rate could be between 1 and 10%, which is what we see in many studies, although studies are quite limited. If the numbers of people who have initiated a transition grow, which they have in the last 20 years, we will see more people in our society who are experiencing shifts in their identity and who are detransitioning over time.
You wanted to stress that it's not anywhere near the majority of people, but also not that 1% number. So is the takeaway from that then that gender-affirming healthcare will benefit the vast majority?
I wouldn't disagree with that. Certainly, I know many people in my own life who would experience this care as life-saving. The available evidence does indicate that a majority of people report benefits. The research, though, especially in the long-term horizon, is still fairly limited, so there are some questions emerging. It's really important to understand all outcomes to better support individuals who are making these decisions.
Do you worry about how your research could be used by people who are against this care?
All aspects of gender-affirming healthcare and our outcomes are being weaponized. It seems like there's just this massive pendulum swing happening, and now it is a swing into a really concerning direction.
Back at that gathering in Edmonton, there's deep anxiety over an uncertain future.
Did any of you use puberty blockers when you were younger?
I didn't have the access. If I knew what transness was and it was accepted in my family, that's something I would have done if I had the choice. Because if I could have gone back in time and not had the fat distribution that I have now, not had the voice that I have now, I would have had a much better quality of life.
These 20-somethings won't be affected by Smith's proposed age restrictions, but they fear for those who would.
I think children now have these words and all of a sudden the adults are going, oh no, they can't be like this, blah, blah. When in reality, we've always been like this. We just didn't have a language for it.
It's already a fight against the fear of trying to be who you are against a society that really doesn't want you to be. All these legislations, everything that's happening in the UK, that only fuels the fire.
Smith says she was looking to Europe when coming up with the planned policy.
They're all making these kinds of really difficult decisions and having these really important public discussions, and we think it's time that we did too.
But critics point to key differences. Outright bans in Europe are still rare, and limits there have largely been suggested by medical authorities, not driven by politicians.
I think it's really frustrating to listen to people who have no stakes in this argue about it.
You look at a country like Sweden, these are reputable organizations saying there needs to be a bit of caution.
Mm-hmm.
So you can't just dismiss that.
I'd say caution is a really big difference than completely restricting and blocking access. I think sometimes people think that doing nothing is the safest, but doing nothing isn't always benign either. Doing nothing comes with permanent puberty changes. Doing nothing comes with distress. I'm quite worried about what could happen with some of these folks who don't have hope. Just having that little bit of hope that things could be better in the future is really, really important.
Hope can be hard to hold on to for those who say this care is desperately needed.
I just feel like leave trans kids alone. Like, she just wants to live her life and she's not hurting anyone. And like every parent, I just love my kid and want them to be happy and like themselves. We're not doing anything except buying some time so that she can make these bigger decisions when she's older.
Do you have any lingering concerns about possible other health impacts?
Yeah, no, I don't. There were many appointments with endocrinologists, psychologists, nurses. We've done bone density scans. We've done all these things to ensure that we're all on the right path. Like any parent, you're like Googling, or talking to the doctors about all the risks. But at the end of the day, if your kids, you just want your kid to be alive.